Hello, welcome to my channel. Today we're talking about schizophrenia. I am on part 2. Today we're doing questions and answers directly from RN Nclex examinations. Please hit the like button, please subscribe, please share this video. My first question. Client is admitted to the ED, was found wandering the streets, talking to unseen others. What should your nursing assessment be? The correct answer is assess signs and symptoms in the last 6 months to further diagnose patient with schizophrenia. For schizophrenia, assess 2 or more characteristics of or symptoms must be present during 1 month period and must last for 6 months to meet criteria. 2 or more characteristics or symptoms must be present during 1 month period and must last for 6 months to meet criteria to be diagnosed as schizophrenia. My next question, client is suspicious that medications are poisoned. What should your nursing assessment do? What should be your nursing assessment? Assess if client is experiencing persecutory delusions. Individuals believes he or she is being conspired against. Individuals believes he or she has been cheated on. Individuals believe he or she has been spied on. Individuals believe he or she is being followed. Individuals believe he or she has been poisoned or someone is trying to poison them. He or she believes they have been arrested or drugged is the correct answer. And these are all signs and symptoms of persecutory delusions. My next question. Patient is admitted. Diagnosis is paranoid schizophrenia. Nurses will gather a background assessments from where? Patient is admitted, is diagnosed with paranoid schizophrenia. Nurses should gather background assessments from where? The correct answer, from family members, old medical records. Client is in acute episode, is unable to provide accurate information. Client in acute or active phase has deficits in communication, has deficits in thought processes. So you have to get information outside of the client, medical records, family members, friends who know this client. Our next questions. What are the signs and symptoms of echolalia? The correct answer is attempt to acquire sense of self-identity. Client repeats words they hear. Client is attempting to identify with persons speaking. When you talk, they try to talk exactly the same way you talk. Client is acquiring sense of self-identity, and these are the correct signs and symptoms of this patient. Next question. What is happening when delusions of influence or control is occurring? The correct answer: patient believes certain objects or persons have control over behavior. Example, client goes to the dentist, thinks filling in tooth will control what he does or what he thinks is the correct answer. My next question is all from Nclex RN examinations. What is magical thinking? The correct answer occurs when individuals believe thoughts or behavior have control over specific situations or specific people. This is magical thinking. Next question. What is associative looseness? The correct answer: thinking, speech, ideas shift from one unrelated subject to another. Client is unaware. Phrases may be understood, but meaning not linked. These are examples of associative looseness. My next question is, when clients imitate other people, physical movements, they are experiencing what? When client imitates other people's movements, they are experiencing what? The correct answer is echopraxia. Client has alternation in sense of self. Client has alteration in sense of self. Client has weak ego boundaries. Client lacks feelings of uniqueness. Our next question is, client exhibits flat affect. Describe flat affect. What is it? The correct answer is devoid of emotional tone, no emotional expression. This person has a flat affect. The next question, client with schizophrenia, what is most likely to benefit? Client is followed up in clinic. What is most likely to benefit this client? And the correct answer is group therapy combined with medications is most likely to benefit this client. What percentage of people in the USA is diagnosed with schizophrenia? The correct answer is approximately 1%. Next question. Client is admitted to the emergency room with sodium levels elevated. Which could be the possible diagnosis? What could be a possible diagnosis for elevated sodium level is the question, and the correct answer is imbalanced fluid volume related to elevated sodium levels. Imbalanced fluid volume related to elevated sodium levels. Next question. What are the signs and symptoms of anhydomia? The correct answer, client with anhydomia diagnosed with schizophrenia. Correct answer, signs and symptoms of depression. Client may generate hopelessness. Client with hopelessness, assess them to be suicidal. Next question. Client diagnosed with schizophrenia has self-care deficits. What does that mean, self-care deficits? The correct answer, client has thought disorder, needs assistance with ADLs, activity of daily livings, inability to perform ADLs, signs of body odor is present, client has poor hygiene, need assistance with ADLs, nurse's diagnosis, self-care deficit. Client admitted with thought disorder, experience clan association. What should be your nursing diagnosis for client with thought disorder, experiencing clan association? The correct answer, nurse's diagnosis, impaired verbal communication. Clan association are choices of words that are governed by sound. Words take the form of rhyming. Example of clan association in the form of rhyming. Example, sold, cold, gold. These are all rhyming. Clan association, impaired thought disorder, impaired verbal communication is your nursing diagnosis. Next question. What is the definition of the nursing diagnosis? Interrupted family processes. Client diagnosed with schizophrenia. The correct answer is there is a change in family relationship. There is a change in family functioning. There is family conflict related to inability to accept diagnosis, and this is your meaning of your nursing diagnosis, interrupted family processes. Thank you. Hit the thumbs up. Please subscribe. Please share this video. Stay tuned for part 3 of schizophrenia. Have a good day. Stay blessed.